Good morning, my name is Shavina, and today I'll be reflecting on how motivated reasonings, evidence literacy, and thinking skills support the 5 steps of evidence-based practice, or in other words, EBP. I'll draw an example from my learning about stroke rehabilitation and connect it with concepts of metacognition and personal bias. Firstly, starting with a personal example from when a relative of mine suffered through a stroke, I strongly believe that traditional physiotherapy would be the best and only effective treatment of recovery. Because of this, I dismissed new approaches like mirror therapy without really exploring the evidence. My personal connection made me more emotionally invested, which in turn increased my bias. I wanted to believe what I felt most familiar and safe with. Motivated reasonings occur when we seek out information that confirms our pre-existing beliefs rather than informing information that may challenge them. At the beginning of my study about stroke rehabilitation, I assumed that conventional physiotherapy would always be superior to new approaches like mirror therapy. Because of this bias, I tend to overlook research showing positive outcomes for mirror therapy. To counter this, I reframe my inquiry into an EBP style question. What is the effective what is the effect of mirror therapy on upper and lower limb motor function in adult patients with a recent stroke compared to other therapies? This question helped me recognize my assumptions and guided me to seek evidence in a more balanced and systematic way. Now I'll talk you through the EBP steps. Using the PICO framework, I structured the question clearly in adult patients with a recent stroke, outlining population, how effective is mirror therapy, outlining intervention, compared to the other rehabilitation therapies, contrasting the intervention, and lastly, improving upper and lower limb motor function, signifying the outcome. This step made me reflect on whether my framing was neutral if influenced by motivated reasoning. I then used evidence literacy skills to conduct structured database searches. Instead of only choosing articles that supported my initial view, I applied systematic search strategies using keywords, Boolean operators, and filter to capture a range of evidence. I appraised the studies for quality and relevance. For example, I compared large-scale systematic reviews, which provide stronger evidence, with smaller case studies that had greater bias and weaker generalizability. Critical thinking skills allowed me to evaluate whether findings were valid or reliable rather than just convenient. Applying the evidence meant imagining how mirror therapy could be integrated onto stroke rehabilitation. I considered that it may not replace traditional physiotherapy, but could complement it to improve patient outcomes, particularly for motor function recovery. This required balancing evidence with patient needs and clinical judgment. Finally, assessing outcomes, including reflecting on how the EBP process reduced my own bias. I realized that being aware of motivated reasonings and using metacognition improved my capacity to evaluate evidence fairly, which is critical for patient-centered care. In conclusion, asking the question, what is the effect of mirror therapy on upper and lower limb motor function in adult patients with a recent stroke compared to other therapies, allowed me to engage fully with the 5 steps of evidence-based practice. Through this process, I developed stronger evidence literacy structure, deeper critical thinking skills, and greater awareness of my own biases. Ultimately, this experience highlighted the minimizing motivated reasoning leads to more balance, evidence-informed decisions, and better patient outcomes. Thank you.